Hi, this is Dr. Nick. I'm the incrementalist. I'm here with Dr. Wayne Derkac. He is the Senior Vice President of Medical Affairs at BioTel Heart and also a cardiac surgeon. Wayne, thanks for joining me today.
Thank you, Nick. I really appreciate you being here with us and us be able to talk to you about our company.
So tell us a little bit about BioTel. I think what's really striking about this, as we had the conversation beforehand, is you've been around for a while.
The company was formed in 1999 and under the premise of developing remote cardiac outpatient telemetry. And actually this device here, which was developed in 2002, was FDA approved in 2002, is the first wirelessly connected medical device in the history of medicine.
Wireless telemetry and challenged with cellular signals, and they had a real struggle with that, which is really kind of interesting because when you talk about the base station, it came with the telephone line, right?
Right, exactly. And that's because the cellular signal could at times be much weaker than they are today, and there needed to be a backup for that. This has an onboard algorithm which analyzes every single heartbeat and then sent in representative strips to one of the independent diagnostic testing facilities that we maintain around the United States for patients who had arrhythmias.
So, and I think the key thing here is that this isn't just a monitoring piece of equipment. There was actually some intelligence here that says, hey, I'm seeing something abnormal, and that gets highlighted. Although the challenge was if you couldn't communicate it, it wouldn't get communicated until such time as the data got uploaded, right?
Yes, and so the progression that's occurred over the last 20 years has been not only in the technical aspects of the device, but also in the evolution of the software in terms of better and more accurate detection of arrhythmias.
So they're finding the arrhythmias and actually improving on the devices. So show us the latest one.
Okay, so the latest device is in fact a sensor patch.
That big. That's it. Stick it on here, right?
Yes, actually it goes like this.
Oh, I got it the wrong way. You need a cardiac surgeon to tell you where to put it, right?
It goes like this, and basically the underlying situation is that this captures every single heartbeat and sends it via Bluetooth to a modified cell phone device which contains our proprietary algorithm. It analyzes every single heartbeat, and should you have something, God forbid, like atrial fibrillation or other kinds of arrhythmias like ventricular tachycardia, it sends us a representative 90-second strip. And if it meets the criteria that your physician has established for you to be notified, we'll call your physician in urgent cases and call your physician and you in emergent cases. Now, it's not an emergency service, obviously, because we're dependent on the cell phone connectivity and things of that sort. But at the same time, it is near real-time notification of arrhythmias.
So that's really interesting. So they're actually putting the algorithm inside the sort of local technology that goes with the patient into the home. So why are you doing that? Why not just send it to the cloud and have it analyzed up there?
Well, we can certainly do that from that standpoint, but at the same time, we're in a situation where we have evolved to this particular point, and who knows what the evolution will be in the future.
So that's interesting. So local analysis that gives you additional capabilities, so at real time, in fact, so for the patient caregivers that are local and as part of that.
Yeah, we like to say near real time, since probably nothing is really real time.
Yeah, no, I understand that. We sort of use that
perspective.
Yeah, absolutely.
But as a result, with this device, we really have been very confident in our ability to say that if it's there, we will detect it.
Fantastic. So just remains for me to thank you, Wayne. Thanks for joining me.
Thank you, Nick. We appreciate your interest, and we appreciate being here.
This is Dr. Nick. I'm the incrementalist. I'm here at the Connected Health Information Symposium at the Rayburn building in Washington, D.C.
Thank you.